Hi there, welcome back to my channel. I'm Dr. Mukhmohit Singh and a very warm welcome to all of you. On June 24th, 2020, the Ministry of Health and Family Welfare, Government of India launched a new India TB Report 2020. So in this module, we are going to cruise through this document and see what are the new updates. So update number one. TB Harega Desh Jeetega campaign was launched in 2019 and it has been scaled up in 2020 now by the Finance Ministry. So good amount of budget is there and a lot of new advancements are happening in this National Tuberculosis Elimination Program, which was earlier called as the Revised National Tuberculosis Program. So I'll be discussing 10 points to cruise through this 360-page guideline, or not the guideline, it's a new India TB report, right? So there are 10 salient features into it. So the point number one, that is India is committed again to end the TB epidemic by 2025, which is 5 years ahead of the Sustainable Development Goals timeline. That is to end TB epidemic globally by 2030. India is committed to end TB by 2025. That is the first thing for you to remember. Second is that the TB forums are launched at district level and at state level. It is for supporting the TB patients. There is another campaign that is TB Survivor to TB Champion. It is a strategy which gives us standardized training modules and it gives standardized IEC modules for all the TB affected communities to give them that positive sense of motivation for taking up these TB medications and boosting the compliance level, so that in order to have a higher cure rate for this program, National Tuberculosis Elimination Program. All the medical colleges will have MDR TB management facilities by the entry of the fifth batch of MBBS students. This will be ensured by the renewal compliance or the renewal inspection by the Medical Council of India. And all the medical colleges, in simple words, all the medical colleges will have MDR treatment, TB treatment management facilities. For sentinel surveillance, delineation of the molecular epidemiology, that means the scaling up of the TB diagnostic levels is there. That is, whole genome sequence facilities and pyrosequencing facilities have been established in India, so that to scale up the TB laboratory, TB diagnostics. The laboratory information and management system has been launched, which is going to check for the external quality assurance of the laboratory mechanisms under this program. The TB program is now gender responsive. That is, there is a separate module for the transgender, and it gives due place for transgender people as well. So HIV TB coordination with presumptive screening. What do you mean by that? That all the HIV cases, they will be presumptively screened for tuberculosis and vice versa, so as to not leave any case of HIV or TB undetected in either of the diseases. Very important point for all of us to remember is something about this case finding. Case finding, as you must have heard from my previous lectures or in previous modules I had discussed a couple of times, that the case finding can be of two types. We can have active case finding or we can have a passive case finding. So now we also have something called as intensified case finding. What is this intensified? See, what is this active case finding? Active case finding is when we go door to door to people's house to knock their doors and ask them about the TB, or maybe symptoms or TB diagnostics. Passive case finding is when the patient comes to the medical facility. Intensified case finding is provider initiated TB screening in all the OPDs, STD clinics, or in all the OPDs in pediatrics, public sector, private sector, in all OPDs, where the doctor or the support staff or the healthcare people will initiate a TB screening. So that is intensified case finding. So all said and done, the point for you to remember for your MCQ exam is that case finding is of three types: active case finding, passive case finding, and intensified case finding. Next is again very important highlight point by the All India, this new India TB report 2020, that all the TB patients will be offered CBNAT diagnostic facility. Earlier, what was happening was that all the patients who were TB suspects or TB presumptive or probable TB cases, we used to send them for AFB and for chest X-ray, and then CBNAT was used only if in case the AFB or the chest X-ray was not conclusive, right? So now, under this new guideline, all TB patients will be offered CBNAT or TrueNAT testing for determining the resistance to rifampicin. It is actually scaling up the laboratory services or drug susceptibility testing services. So those were the 10 points, just a very quick review of what we have studied till now. The newer initiatives in TB diagnostics. Foremost is CBNAT, external quality assurance has been scaled up. TrueNAT is integrated into the NTP structure. See, what is TrueNAT? TrueNAT was launched by the ICMR. It is an India system built TrueNAT, which is relatively inexpensive and gives the almost same sensitivity and specificity for diagnosis of tuberculosis. So now TrueNAT will be integrated into the system. Then there is augmentation, of the laboratory capacity, and laboratory information management system will be scaled up. Genome sequencing facility upgraded. BD USAID partnership. What is BD? That is Becton Dickinson USAID, United States Agency for International Development Partnership, making strides against MDR-TB. What is this strides? This can be a potential MCQ. Strides TB is strengthening TB resistance testing and diagnostic systems. That is an acronym for strides. And then we also have Node TB, that is Network for Optimized Diagnosis to NTB. And e-training content development on eSwasthya website of the Ministry of Health and Family Welfare. Last, just to finish off this module, I would like to take this opportunity to discuss this 5-star topic of what is functions of NICSHE. Ni means no, Kshe means tuberculosis, so it's a no TB, right? So it's a no TB. So what are the 6 elements of this no TB campaign? Testing, treatment initiation, public health action, adherence monitoring, outcomes, transfer, and referral. These are the 6 important functions of this NICSHE module. So India TB report 2020, there's the cover page of India TB report. So you can see that National TB Elimination Program has decentralized the DRTB treatment at the district level. India TB report also accomplishes the active case finding. Please remember, active case finding was introduced very, very recently, and it basically promotes more TB detection. And you can see that annual TB report, 24.04 lakh TB patients had been notified in 2019. This amounts to 4% increase in TB notification as compared to the year 2018. So of course there is more number of TB notifications, but it is actually better diagnostic system or the public health system. The NTEP also announced some of the best performing states for the year 2019. So the best performing states and UTs for the year 2019 were Himachal Pradesh, Gujarat, Andhra Pradesh, and the UTs were Dadar Nagar Haveli and Daman Diu, and Tripura and Nagaland with the population less than 50 lakh. So these were some of the best performing states for year 2019. So with that, thank you very much for watching this module. All the best.